I'm Helen Farmer. Fantastic to have you with us. For the kids listening today, do you recognise this guy?
So much to learn about, it'll make you want to shout, Blippi!
He's coming to Dubai. We have got 4 tickets for you to go and see Blippi and Mika on stage. They're going to be there 12th to 13th of December at the Coca-Cola Arena. Monster trucks, excavators, garbage trucks and more. You can buy your tickets on the Coca-Cola Arena website now, or you can win them with me if you tell me which 2 colours does Blippi love to wear. Send that in on 4001. You've got the app as well, of course, and the WhatsApp too. Make sure you've got your name on it. I've had some adorable messages. Shout out to Theo, who I can tell you got the answer absolutely right. You can send voice notes, videos, photos of your little ones, you Blippi fans, to go into the draw. We are talking men's mental health now. I'm delighted to be joined in studio by Dr. Yasir Ali Malik, a specialist psychiatrist at NMC. And we've got a lot to talk about. We haven't got much time, so we're going to try and get through as much as possible, because a survey showing mental health in men says that, 77% of men polled suffered with a common mental health symptoms like anxiety, stress or depression. 40% of men have never spoken to anyone about their mental health. And I wondered, Dr. Yasir, if we could perhaps by starting to talk about why is it important to talk about this?
Good afternoon, everyone.
Good afternoon.
Mental health is an essential component of our life. Like when we talk of health, it is not only physical health, it is emotional, psychological and social well-being. So that is how we define mental health. So it's particularly important to talk about because in a present-day society, the age we live in, there's an epidemic, of mental and emotional disorders. Mm-hmm. So I think it's essentially important. It's very, very important.
It's about normalising. We were just speaking earlier to our guests about, conversations in the barbershop chair about, men fostering a friendship group where it's okay to say, I'm struggling with this, or I'm not finding, this easy right now. What do you think are some of the big myths associated with men's mental health that you'd like to address now?
So, some of the common myths, that are prevalent, in the society is like, mental health is a sign of weakness. Very, very commonly, they say that. So, if it's a physical illness or physical ailment, people are happy to talk about it. But the moment it comes to the mind, or we refer to mind, it rings a bell, and people feel that probably if I come forward, it will be taken, especially when we talk in terms of men, So the society has a stereotype, they look at the particular image of the men. So their men have always been, they have been looked in a way like they are like having masculine traits and they're supposed to be the breadwinners in the society, the family, and they can't seek help and they should take care or control of everything. So I think this needs to change, this stereotypical thinking, and also the stigma about being labeled. If I come ahead and if I talk about my emotional or mental health condition, probably I'll be labeled forever, right? So I think that's a myth. Like mental health is not a sign of weakness. Actually, when you come forward and talk about your mental or emotional problems, it shows that you're serious and you want to get your life back on track.
Yeah, it's being proactive. It's actually a sign of strength, I think, and there's a huge kind of mindset shift that I think is happening in some communities and in some groups, but as a whole, we're not there yet. And
Right.
Priory commissioning this survey,
Absolutely,
1,000 men.
Yeah, another myth. Commonly, when people engage in treatments for mental health conditions, a common myth is that probably the medications are, in a way, are going to be addictive. Like medications are addictive, or the person has to be on treatment forever. Which is not the fact. Actually, it may be that for some time the person may need to be on the treatment, depending upon the type of treatment, and it may necessarily need not always be a medication. It may be a psychological treatment, a therapy. Initially, or sometimes both medication and therapy go hand in hand. But it doesn't mean that forever. And antidepressants or medications that we use for mental and emotional conditions are not addictive at all.
Now, 40% of those 1,000 men polled in the UK by the Priory said it would take thoughts of, suicide or self-harm to actually compel them to seek professional help, which it's terrifying to me that it would get to that point. When do you find that men tend to reach out to you, Dr. Yasir? Or what stage are they at? Does it get to that point of desperation?
Right. As you talked about the survey, this is a very important question. So normally in my clinics and in the clinical setup, I come across men, and often they come, when they're in the stage and they're quite advanced in a way that they've been suffering from difficulty, problems in social, occupational, interpersonal functioning, and as I mentioned earlier, also that often because of the societal expectations, the stereotypical, way in which the society looks at men, often the way they express. And they are reluctant to talk about emotional and social problems. Mm-hmm. They're reluctant to talk about that they're feeling low, they're feeling sad, they're feeling depressed. And at times, the way men present compared to women, they may present in another ways or in the form of a functional symptoms. Like, for example, I'm having problem at workplace. I'm having difficulty with my sleep. I'm having a headache, which is not going. I've tried so many things. I've been to so many doctors. Unexplained somatic complaints. So the way men present is different from the way women present. They may present with sadness, maybe probably when they're suffering from serious depression or anxiety later on. But generally, the way they present, because they're reluctant, as I said. So the stigma, the stereotype, societal stereotype, all these factors play a huge role. So they find it difficult to confide that probably they are also suffering from behavioral or emotional issues.
Mm-hmm. Now, as a psychiatrist, as you said, you can prescribe with medication, and I think that can be quite a scary thing for an awful lot of people. I mean, I've spoken about this very openly in the past. I had postnatal depression. I was on meds for about 4 years, and I was nervous about telling people that, which is, now I look back, is completely logical, because it didn't space me out. It didn't make me a poor employee. It made me a much better wife and a much better friend, and I came off them, touch wood, with absolutely no issues at all. But I think it can be an intimidating thing. It's something that other people do. Other people take antidepressants. Other people take anti-anxiety medication. And I would imagine that you probably know an awful lot more people than you might realise who are on those medications right now. What I wanted to ask you as a specialist psychiatrist and as a man as well, is the role of partners and friends. If we start to suspect that a man in our life, whether it is, a husband, boyfriend, brother, dad, son, is struggling with their mental health, how can we encourage them to get some help without pushing them away, without perhaps alienating them? What do you find to be some, useful strategies, language, techniques?
Right, that's a very good question. See, when we suspect someone, a friend or a family member or a close anyone, like if you suspect someone is suffering from depression, the first thing is probably make them understand that it's important to talk. So that is the first step, actually, in this journey,
Mm-hmm.
because most often the person, they don't feel like talking to anyone and they are suffering from inside. So talking, showing empathy, that is very, very important, because if you need to empathize and you need to show genuine concern, because when you show genuine concern, the person will come up or bring his or her complaints, talk about them, right? And that is the first step in this journey, as I said. And from that on, you can, and depending upon, it could be making them understand if they want to talk to a close family member, if they want to talk to a friend, if they want to talk to their partner, that depends.
So getting that communication line open.
That is very, very open, yeah.
Mm-hmm.
Yeah.
If I could make you Minister of Mental Health for the entire world, okay, I'm giving you all the power, what would you like to see change, whether it's in society, the home, the workplace, healthcare, that you think can help head off what is sounding like an increasingly scary situation for men's mental health?
I think the most important thing that we need to change as society, and being a mental health professional myself, I think what is very important is that we need to change this perception, of, treating mental or emotional conditions different from the physical conditions or physical ailments. This needs to go, especially in the age we are living in now, because mental illnesses are very much biological. That is what the research says. They're very much like any other physical illness, and they do get better with treatment, and very effective treatments are there. So rather than suffering for years and years with mental and emotional conditions, the person needs to come forward and the society needs to change.
Yeah, Dr. Yasir, well said indeed. I'd give you the job. Thank you so much for your time. Dr. Yasir Ali Malik is a specialist psychiatrist working across NMC clinics. We are very much on hand to help across all sorts of different topics on the show today. We're going to be asking about shopping addiction after 4 o'clock. Clinical psychologist Dr. Thuraya joining us, and an expert of a different kind. It's producer Poonam now with the latest on your roads.
Dubai Eye 103.8 traffic.
With Yas Island Abu Dhabi. Stay at iconic hotels and